I'm Bonnie Wegener. I'm the chairperson of the LPN department. Welcome to our lab. This is our main classroom and our lab. As you can see, everything is socially distanced. Everybody sits at their own table and does their work individually. The group is split between two classes usually. The lectures sometimes take place in here when we're all together as a group, and other times you'll be having your lecture online. The program starts out by giving you your Chromebook orientation and teaching how to access the Google Classrooms and access all the information that we have for you. From there, you come in and you basically learn about infection control. It starts off very basically, and as we move forward in the program, everything gets a little more difficult. We have our new smart TVs that we're able to present our material, our lectures, our slides, any kind of videos that we have to show you, which makes it a lot easier because we used to have to turn all the lights off. Now you can see your notes, take notes, and also be able to participate in the lecture. The program in the lab begins basically, as I was saying, kind of with washing your hands, how to put on gloves, how to put on sterile gloves, and how to take vital signs. Everybody gets a blood pressure cuff and a stethoscope when they come in the program, and you get fitted for your own set of scrubs that you'll wear when you come into lab and when you come into the clinical settings. After you learn how to take vital signs, we go on to wound care. And we have a couple of different models here that we teach you how to do wound care. Each model has a different type of wound, and we discuss the wounds, how to treat them, what kind of gauze, what kind of treatments to put on, and we get you to practice on these different things and learn how to irrigate and dress a wound. From there, we go on to learning about doing a bed bath, making a bed, doing a head-to-toe evaluation on a patient. This is our newest mannequin, and she is actually an auscultation mannequin. What that means is when you put your stethoscope on her chest, you can hear her heart sounds and her lung sounds. So when we could go into the clinical settings, she was very helpful to us because we were able to teach students different heart and lung sounds without having to actually be in a clinical setting. So if you come into the program, make sure you take a listen because she has some really, really cool sounds. From listening and feeling and checking out a patient and bathing a patient and doing beds, we go on to learning how to take care of the gastrostomy tube. We developed some different materials that students can actually sit at their chairs and they can do the skill from their seats without having to get close to each other around the mannequin. When people come into the lab, everybody has a mask. You're actually going to have to get fitted for an N95, and we give you a face shield so that when you go into the clinical settings, we know that you're protected and the patients are protected. We learn about oxygen therapy. We learn about doing straight catheterizations on patients. We learn how to suction. We have inline suction. We have open suctioning. And again, we've developed some really pretty cool tools that students can work with at their chairs and do suctioning and trach care socially distanced without being around the mannequin. After you finish all that, you're going to come around and you're going to learn how to give a medication. We have our medication card over here that's stocked full of all kinds of different medicines. And you're going to learn how to crush medications with our crusher. You're going to learn how to give intramuscular, subcutaneous, and intradermal injections, doses calculation, and everything that happens during the lab is lined up with the program. So as your knowledge is advancing, so is the content area in the lecture. We start off with fundamentals and foundations of nursing and pharmacology. We learn anatomy, which is the structure of the human body. And then that goes on to medical surgical. We do mental health. We do community, pediatrics, obstetrics, and then we end the program with a leadership class. Our leadership class actually gets you ready to go out and get a job, where you do your resume, you do a portfolio, so that when you walk out of here, you're ready to take your NCLEX exam and you're ready to put out your application so you can work as an LPN. It's a great program and we look forward to having you.